My name is Mathew Fine, and I am a periodontist practicing in Miami, Florida. I have been using the OSSIX Plus membrane for about 10 years now, and I constantly get questions from fellow doctors and students about why this membrane seems to be my go-to membrane for the majority of my bone grafting procedures. So I wanted to take a few minutes here and answer those questions and discuss some of my favorite features of this amazing material. My favorite feature of the OSSIX Plus membrane, and what I think really sets this membrane apart from everything else on the market, is that this membrane is cross-linked with naturally occurring sugars. This cross-linking results in a membrane that maintains its barrier function for over 6 months. I have seen the amazing histology, but more importantly, I see this every day in the office when I expose my cases following months and months of healing. As you can see in these 3 cases, the membrane is stable and nearly intact after 4, 6, and sometimes even after 8 to 9 months of healing. This gives me the confidence that the membrane is doing what it is supposed to do, which is to exclude soft tissue cells, giving the bone underneath time to mature. Another incredible feature of the OSSIX Plus membrane is the fact that this membrane is resistant to degradation when left exposed. In many cases, obtaining primary closure at the time of extraction can be challenging surgically, but also serves to move the mucogingival junction, which may require additional surgery to correct following GBR. With the OSSIX Plus membrane, I can leave a portion of the membrane exposed and know that the new keratinized tissue will migrate over the exposed membrane without significant membrane degradation. You can see the healing of the same case after 4.5 months. As you can see, we have more than an adequate band of attached keratinized tissue with no displacement of the mucogingival junction, and of course a tremendous amount of defect fill even outside the alveolar housing. In fact, at the time of exposure of my large bone grafts, it is very common for me to see remnants of the OSSIX Plus membrane still intact, as I have showed previously. And histology has showed that the membrane is actually ossifying over my bone grafts, which gives me confidence that I will have a long-term predictable result. Another amazing feature that sets this membrane apart from anything else on the market is its handling. While OSSIX Plus handles differently than all other membranes, I believe it has the best handling for several reasons. The membrane does require hydration, but that simply means that the membrane needs to be soaked in saline for 30 to 60 seconds or so. The membrane can be trimmed either before or after hydration and is dual-sided, so there is no worry about placement of the membrane in the wrong direction. Once the OSSIX Plus membrane is hydrated, it conforms beautifully to the bone graft materials and should be placed and extended beyond the margins of the defect, resting on native bone. Pressure with wet gauze or even finger pressure can then be used to conform the membrane to the graft to obtain the desired shape, as you can see here. Another great feature of this membrane is that it can be stabilized with tacks or sutures. Anybody that follows me on Instagram probably knows that I will typically stabilize the OSSIX Plus membrane during my larger bone grafting procedures with periosteal biting stabilization sutures. This is a very simple technique that eliminates the need for screws and tacks and can provide excellent stabilization of the bone graft membrane complex. The final reason why I tend to use the OSSIX Plus for the majority of my bone grafting procedures is due to the versatility of this membrane. As you can see here, this membrane works very well for simple socket-type grafts, but can also be used for larger guided bone regeneration procedures. In cases of moderate to severe buccal plate deficiencies at the time of extraction, this membrane gives me the confidence to place my immediate implants despite the extent of the defect, and I know that I will get excellent hard tissue regeneration. I am also able to use this membrane for ridge augmentation for varying degrees of ridge deficiency. As you can see here, in the presence of a mild ridge deficiency, the OSSIX Plus membrane can be used, and after 4.5 months following treatment, a significant amount of new bone formation on the buccal aspect of my implants can be obtained. In cases of more moderate ridge width deficiencies, the OSSIX Plus membrane can also be used in a similar fashion as illustrated by this case. Before I started using the OSSIX Plus membrane, severe ridge width deficiencies like this one were intimidating and forced me to use non-resorbable materials such as titanium mesh and PTFE, with or without tenting screws, to have the confidence to regenerate sufficient ridge width for implant placement. But with OSSIX Plus in my bag, using the same techniques that I have illustrated throughout this presentation, I'm able to regenerate adequate bone to support implants without the inherent risks with using non-resorbable materials. This makes the surgery less stressful for me and is safer for my patients. So I hope I have been able to answer the questions for why OSSIX Plus membrane is such an incredible membrane for bone grafting procedures. Please feel free to contact me with any questions. Thank you.